All right. On to point three of the plan. Um, Next one, and continuing on the theme of things that I think we can all agree on, regardless of where you're from in the country or what your political persuasion is. I think we can all agree that healthcare is out of control in the U.S., unaffordable for the average person. And I would say, in general, we have a excellent healthcare system. It's just that it's unaffordably expensive. If you can afford it, it's great. If you can't afford it, you're out of luck. And we can't have the wealthiest country in the world have it be that the average working person can't afford healthcare, can't afford to take care of their family, can't afford to take care of their kids, or where some people get really excellent care and some people can't get any care at all. That's not sustainable. It's nonsensical. So the question is next on the agenda. Let's all come together and work with each other on how to make this affordable. And the question is, how do you do that? So I have a plan that covers 6 points, and and the reason it's 6 points in a larger plan is because I think there's no one silver bullet on how to take care of this. I think it's a series of smaller incremental things that will tend to bring it start to get costs under control. And I also think that's why in the past your Democrat or Republican, whoever, always said, "Well, this is an insurmountable task that we just can't even make any progress on because it's just too massive." That's just an excuse because they've been paid by the medical industry and the medical lobby. This is surmountable, but you have to make some incremental progress. So first up is the first thing that strikes me about this. Obviously, everybody I think is up in arms because you have these for-profit insurance companies taking a share of profit, making sure treatment is minimized and revenues are maximized because they're in it for the profit. And one of the things that strikes me is when I was a kid, the health insurance plan that we had, that my family had, was nonprofit. And now I know today, things are for profit. And I think to myself, what happened in there? And if you dig into the history a little bit, and I'm not an expert in this area, but you just do a little bit of digging, you find that prior to around 1970 or so, that most plans, insurance plans, were nonprofit. And then through a series of incremental steps to make it worse, legislation was introduced to encourage for-profit insurance. In 1973, there was an act that encouraged private for-profit insurance companies. That was increased again. Medicare Advantage Improvement Act in 2003 encouraged uh, private insurers to get on board with that, which were for-profit, and so on. There's these small acts that were encouraged by lobbyists that made things transition to a for-profit system. Does it have to be that way? It does not. There are countries in the world where private insurance has to be nonprofit, and I don't see any reason why we couldn't do that in this country. So that's point one. That should give some immediate relief on prices if you make things required to be nonprofit. And just fundamentally speaking, it doesn't make sense for a required health based service for people to profit off that. I don't think anybody really likes that idea to begin with. Number two, I like there's been some progress made, incremental progress on doing most favored nation prices for the U.S. for drug prices. I like that idea. I would do it across the board and say that the U.S. shouldn't be subsidizing other countries with where we pay the highest drug costs, so that other countries can pay the lowest. That doesn't make sense. So I would introduce more most favored nation drug pricing. But along with that, by the way, is, again, if you dig into the history a little bit and you say, well, how did you get there where we have the highest drug costs in the world, where other countries don't pay that much? How do you get there? And the answer is there was another act where people lobbied and said that the government, in a congressional act, lobbyists made sure that part of the act says that Medicare is not allowed to negotiate drug prices. So think about that for a second. Medicare goes to a drug company, Pfizer, Merck, name the company, and says, "Okay, we want to purchase this drug for our members." They just have to accept whatever numbers put on the table by that company. Like who does business that way? And that was done through congressional legislation, and you know why that wound up in there. Other countries, they're free to negotiate the prices, and then these companies come to the table and they say, okay, yeah, what we don't have to charge that much. We'll charge, maybe they meet in the middle. In the U.S., they put their price on the table, and then that's the price that gets paid. That's nuts. That needs to change. That'll help to bring prices down. What next? Well, again, if you look, I've had some exposure to insurance in foreign countries, and one of the one of the things that you notice is, first of all, some countries don't have for-profit insurance. If you're going to run an insurance company, it needs to be nonprofit. The other thing is that they will cap cost increases to inflation, which just stands to reason, because there are times when you go to your insurance and it's gone up 12%. Well, inflation didn't go up 12%. Why are you raising this 12%? In some countries like Germany, Switzerland, Australia, they can't just increase any number that they want. It has to be in line with price increases. And then also there are other countries again where administrative costs are maxed. Like you can't just have a health insurance plan and have the administrative costs, the medical costs be a certain amount and the administrative costs be a different, huge amount. They keep an eye on the administrative costs, so you're not just funding administrations and executives and things like that. We can introduce caps on yearly increases and caps on administrative uh, costs as well. And then point five, I think part of the way that we wound up here is, the number of medical school graduates has been traditionally, I mean, it's well known over decades now that medical school graduates, the number of doctors that are introduced each year are have been artificially controlled by the medical schools and the AMA, as well as the number of doctors that come in. So if a doctor comes into the country as a doctor who's qualified in another country, a lot of times they'll say, "Sorry, you can't practice here. If you want, you can apply to medical school, but your qualification doesn't mean anything in the U.S." And again, that's just artificially controlling, well, supply and demand. The demand for medical services is up here, and they control the supply of doctors and medical professionals down here in order to keep prices high. And we respect doctors and we want them to be paid a good amount for their services, but you also have to respect the free market. And if people are willing to work as doctors, and that would create more supply and bring prices down, we have to do that as well. And that is something that's for example, I'll get back to which of these are in the control of the president, but that falls under the purview of the president and the FTC, the Federal Trade Commission. And then finally, one more thing, the big one. So after you make these incremental improvements and cost reductions, the big one, which would take longer to negotiate with Congress, is to create an option to buy into Medicare. And again, one of the things that they focus on to divide people and make sure there's no progress on this issue ever is to say that there's two options. One is we'll go to a completely socialized system where everything's paid for and you don't have any choice of insurance, or you have private for-profit insurance, one or the other. And then some people say, I want this one, and some people say they want that one. And then the Republicans and Democrats say, oh, we can't do either one. We're fighting over it. There's no solution to this. Well, there is a solution. There is a middle ground that we can all agree on. And the middle ground that everybody watching this hopefully can agree on is the middle ground is to have a system of private insurance alongside buying into the Medicare system if you want. And if you don't like the service, people say, well, the quality of the healthcare that you would get from government is not good. Fine. Well, then buy the private insurance. That you're open to do that. And if you don't like the private insurance, or you think the Medicare is for you, buy Medicare. give people an option. What's the big benefit of that? The big benefit of that is it actually creates competition for the private insurers, and they then have an incentive to control their administrative costs, um, control their prices, and so on, because there's inherent competition in the system. That there's different estimates out there of what it would cost for people to buy into Medicare, if they're below the age where they currently just get it, and the numbers are significantly less than private insurance are, which stands to reason because it has less administrative costs, it has less profit involved. So, and there are systems. This is not my personal genius idea. Countries do this, for example, in Australia. That's what they have. You can either use the standard system, or you can buy private insurance and additional private insurance, whatever you want, and it keeps the private insurance in line because they have something they have to compete with. So I would open up. The other big benefit of this, by the way, is if you open it up all the way down to people who are 18, for example, um, the people who are 18, 20, 30, if they wanted to buy into Medicare, it would be inexpensive for them, but it also would help to subsidize the cost for the older people who are on it. It increases the risk pool. The risk is very low for younger people, but they'd want to buy it anyways in case they break a leg or something. But those payments will help to offset the high costs for the people who are 70 on Medicare. So I like that solution. That one would take longer to get to, but we can get there. Um, and hopefully everybody agrees on these ideas. So in terms of these, how do we get there? Getting to a nonprofit would require legislation through Congress because, well, that's a congressional issue. I would propose that legislation in the first year, and then again, we'll track who votes for it and who votes against it. Um, the Medicare most favored nation, and letting Medicare negotiate drug prices. This is kind of a gray area because the current president already did that via executive order. So maybe it is within the president's purview. If so, I would do that within the first year. Or if we need to work with Congress, I would work with Congress in the first year. Capping increases, we can do that via the Federal Trade Commission. That is within the executive branch, capping the increases each year to inflation, and the percent that this company needs to stay below in terms of administrative costs. We can do that within the executive branch, without approval of Congress. And then where supply and demand is controlled by a single entity, the American Medical Association, um, that's an antitrust issue. That's a Federal Trade Commission and can be handled directly by the executive branch of the president. I would take that on in the first year. A private option, or opening up a Medicare option for individuals who don't qualify for Medicare, opening it up, that option, that would be a year two thing where we work on and negotiate how that works with Congress, get that proposed in the second year, and then we could flag by 2030 who voted with us on that and who voted against us, and name and shame those who don't want a Medicare option. They want to force you to buy for-profit insurance. So that's the plan, to start bringing these costs down. I think these will actually bring costs down, not just reduce the amount that it increases each year, but actually start to bring these costs back down. All right.